Hey there, future nurses. Welcome to Guided by Night. I'm Dr. Knight, your DNP nurse educator and mentor. Guys, last week we had a great conversation on SBAR, situation, background, assessment, and recommendations. We defined SBAR as a structured way of communicating information about our patients to another healthcare provider. We went a little bit further by defining SBAR as a tool that helps nurses organize their thoughts so that we do not forget detailed information about our patients while handing off to another nurse, a doctor, or any other healthcare professional. I want you guys to remember this. First impressions matter. The way you start off your SBAR will set the tone of the conversation. If you start off with confidence, you will engage your listener right away. If you start off rambling and stumbling, you can potentially lose the listener. That is why today I'm going to be breaking down the S in situation so that you always start off strong. Let's define what is situation. Situation is like the opening statement. It's going to help you tell your listener who you are, who the patient is, and why you're calling. It's going to help you focus and narrow down the situation to less than 30 seconds. I'm going to give you 3 steps on how you can do that. First, I want you to identify yourself, name, unit, and your role. Number 2 is identify the patient. State the patient's name, age, location, and you can even mention something like the patient's code status, relevant information. Number 3, state the immediate concern. Why are you calling about this patient? If you focus on these 3 things, you will be able to deliver your situation in less than 30 seconds. Let me give you an example of a 30-second situation. Here, hi, my name is Olivia. I'm the student nurse on 4B. I'm calling about Mr. Johnson, a 72-year-old male with pneumonia in room 214. He is experiencing increased shortness of breath and his oxygen saturation has dropped to 85. That is a straight to the point situation. Focus. Now, I want to demonstrate to you a weak versus a strong situation. Let's start with the weak one. Hi. I'm calling about my patient. He doesn't look so good. Now, guys, this really jeopardizes patient safety because we didn't give any information and the listener or provider cannot help us with any recommendation or interventions to help our patients. Now, let's do a strong situation. Again, hi, my name is Olivia, student nurse on 4B. I'm calling about Mr. Johnson. He's a 72-year-old male in room 214. His oxygen saturation dropped to 85 and he is in respiratory distress. Now, that's a situation that's going to get your listener to thinking about what they need to recommend, what interventions need to occur, and how fast they need to get to the bedside. This is how you want to deliver a situation. Which one would you prefer to hear? I know I want to hear the one that's giving me specific information about my patient so that I can determine what is next. I can anticipate what the patient needs. I also want to give you 3 other tips that's going to help you improve your delivery of the situation. Number 1, keep it short. Remember, the listener doesn't need too much information. Number 2, always state the most urgent reason first while you're calling. And number 3, write down your S. You can write it down so that you avoid rambling. After you are practicing using SBAR, you will get better. You will no longer have to write it down. You will know exactly what information that you need to give. But we must practice. Practice will make us all better. It will help us improve our communication skills. Here's a challenge for you guys. I want you to start using SBAR during your clinical rotation. Use it while you're handing off to the primary nurse taking care of your patient. Practice it with your colleagues, and also use it while you're handing off to your clinical instructors. Practice will help you get better. I also want you guys to remember that clear communication saves lives, and SBAR is one of the nurse's superpowers. It's going to help us improve our communication and keep our patients safe. Going forward, guys, I want you guys to subscribe. I want you to hit the like button. And I want you to share this video with other nursing students, nurses that are struggling with SBAR, new graduate nurses, anyone that you think that need help with delivering better SBARs. Share the information with them. Lastly, guys, we're going to continue with this SBAR series. Next week, we're going to do background, and then we're going to do assessment and recommendations. And in the finale, we're going to put it all together. As long as you stick with me, guys, I assure you that your delivery of SBAR will get better. Happy clinicals.